So I'm just going to be doing the Foley checkoff. So prior to everything, I'm going to make sure I do hand hygiene. Um, and then I can walk into my patient's room. Oh, I also have my correct equipment, everything that I need to get started. Um, and also knowing that my patient's already been washed and bathed, so I don't have to clean the perineal area prior. As far as like nothing like iodine, we get into that later, but I don't have to like cleanse any further. Um, so then that's when I can walk into the room. I'll do some standard protocol. I'll introduce myself. Hi, my name is Cameron. I'm going to be your nurse today. Provide some patient privacy. I guess I could do some more hand hygiene if I really feel like it. To make sure I have the right patient in front of me, I'll get their first and the last name, their date of birth, and as well, I'd like to scan their wristband just to triple check, I guess. On top of that, I'm going to explain the procedure really quickly. So we're going to be doing a Foley. It's going to be quite invasive. Just making sure I'm getting like some patient communication and making sure that I get some adequate consent. And throughout the entire process, I'm going to be making sure to explain everything, exactly what I'll be doing. And this will be my patient. It's like a good representation. So after that, I can start opening everything. So I'll take this out first. And I have a trash can in between these, so I don't have to turn around or anything. Alright, so I can place this box probably in between the patient's legs. We're going to position them. So we have a female patient. We're going to be doing a female Foley catheter. And we're just going to have the legs spread open. And then from here, only like exposing like the area that we need to work with. So I can get this box here, open it up. Perfect. And making sure that I'm not touching anywhere inside the inch border. Alright, so I kind of just had to adjust my workspace, just to adjust my patient. So now I can don my sterile gloves. I'll do it over here, so I'm just not in the way of over there. Also making sure that that doesn't go into my sterile field. And since I'm left-hand dominant, I'm going to start with my left hand, making sure to touch only the non-sterile inside. Move in. Perfect. And then for the right hand, I'm just going to touch sterile to sterile, go underneath here, and then on top, I can stick my hand through, and my glove is on. Perfect. And then I'm only going to touch sterile to sterile, and I'm not going to touch the inside with the outside. So I have my sterile gloves on. Perfect. So now to kind of organize everything I got here, I'll place this here and here. Perfect. And I'm making sure I'm not doing anything with my hands, not putting them below my waist. So to start, I'm going to get the iodine tear, move the forceps a little bit, and then place the iodine on top of the cotton balls over here, and then drop that into my trash can. Get the lubricant, place it inside the tray, and then once I'm finished, again, just drop it right there. And then I can move my forceps out of the way. And right now, I'm just going to get out the actual Foley. And I just want to make sure I go here. And I can drop that into the trash. And I will place this inside the lubricant. Next, I can get the syringe. I can drop that into the trash. I don't want to do that currently because I need the rubber stopper. So I'm just going to place it there. And then I can attach this onto the Foley, like so. Perfect. So now that I have everything set up, I can move over to the patient, and then I'll use my non-dominant hand to spread her labia. And now that my hand is non-sterile, I can't move it. So to begin with, I'm just going to get the forceps. Since they're already soaked in the iodine or the cleansing unit, I'm going to cleanse her vaginal area. So first I'm going to start with the outermost part, come back here, and then I'll drop that into the trash can. The next one, I'll move from the side closest to me. Cleanse. Perfect. And cleanse the center. And I'm only doing like one stroke. I'm just trying to explain it as I go through. And then since I've already cleansed, so I went once to the center, I can drop my forceps. Perfect. So now I have my catheter. It has been lubricated. And now I can, as I explained to the patient, I'm just going to insert this into her urethra. So I'll place it in and then advance. And then once I feel resistance, I'm going to advance 2 to 3 inches further. And then once I'm 2 to 3 inches further, I'm gonna hold with my right hand, and then with my sterile left hand, I'm gonna come over here and press down on the plunger. And then I'm gonna keep my hand on the plunger. I just have a cardboard box. I don't wanna go all the way down with it. But expect a lot of pressure, push all the way down. Keeping my thumb on the plunger, I'm gonna check for any resistance with my right hand. And if I do feel that resistance, then I know that I'm all the way in there, so I can let go with my right hand. I can also, I'll leave that here for now. Let's see. I can also throw this away just to move it, but it's just awkward because I'm left-handed. I can also take this out, the syringe, and I can drop it right here. Very cool. And since it's in there, I'm gonna make sure to secure this to the patient's thigh with some type of like non-abrasive adhesive. Get the Foley, and I'll just let it hang out. I can't, there's nothing to hold it in there. And I can get the bag and I will place it beneath the patient's bladder. And then that's that. I can clear everything off. I'll position the patient back where she needs to be. I can cover her back up, document all the procedure that's been done, anything abnormal, make sure the patient's good, and then and that's it, yeah.